skin at night penetrate more deeply and are more bioavailable than the same substances applied during the day. You are not just applying the oil at a convenient time. You are timing the application to align with your body's natural healing cycle. This is chronobiology, the science of timing biological interventions. And it matters far more than most people realize. So let me give you the practical guidance you need to actually use this. When selecting a black seed oil, quality is everything. You want an oil that is cold pressed and unrefined. Heat processing destroys TQ. Chemical solvent extraction introduces contaminants. Look for a product that is certified organic, that specifies Nigella sativa as the botanical source, and that has been third-party tested for TQ content. Thymoquinone content in quality black seed oils should typically range from 1 to 3%. Anything that does not disclose TQ content on the label or through a certificate of analysis is a product I would be cautious about. The application protocol that has been used in the most promising clinical studies involves warming a small amount, roughly half a teaspoon, of the oil between your palms and applying it in gentle circular motions to the target areas. For pain and inflammation, joints, the lower back, the knees, apply directly to the affected area. For systemic skin health and the stem cell activation effects, the chest, the inner forearms, and the neck are areas with high transdermal absorption. For joint pain in the hands, which is extraordinarily common in seniors, massage the oil directly into the knuckles and the webbing between the fingers. Allow the oil to absorb for at least 10 minutes before covering with clothing.
Yeah, there's quite a few of the similar
Do this
components.
every night consistently for a minimum of 8 weeks before evaluating results. Biological change takes time, and anyone who tells you otherwise is selling something. One more thing I want to address before we wrap up, and that is safety. Black seed oil has an exceptional safety profile. It has been used medicinally for over 2,000 years across multiple cultures, and modern toxicology studies confirm that it is well tolerated in both topical and oral applications. However, as with any bioactive substance, there are considerations. If you are on blood-thinning medication such as warfarin, speak with your physician before adding black seed oil, as TQ has mild anticoagulant properties. If you have a known allergy to plants in the Ranunculaceae family, do a small patch test before broader application. And if you are currently undergoing chemotherapy, please discuss this with your oncologist before using it. Not because of any known harm, but because of the importance of not introducing variables during active cancer treatment. There is a reason this information does not get the attention it deserves in mainstream medicine. It is not because the science is weak. I have walked you through the actual studies today. It is because naturally occurring plant compounds cannot be patented. Without a patent, there is no multi-billion-dollar incentive to fund the large-scale clinical trials that would bring this into mainstream medical guidelines. That is not a conspiracy theory. That is an economic reality of modern pharmaceutical development. And it means that the responsibility falls on physicians like me to read the independent literature and bring this information directly to the people who need it. For seniors dealing with chronic pain, slow healing, skin deterioration, immune vulnerability, and the very real fear of cancer, this is not just a wellness tip. It is a scientifically grounded intervention that costs almost nothing, carries minimal risk, and has a body of evidence behind it that grows more compelling every single year. You deserve to know about it. I hope this video has given you something genuinely useful, not just interesting, but actionable. If you found this helpful, please do me a favor and hit that like button right now. It sounds like a small thing, but it tells YouTube's algorithm that this information is valuable, which means it gets shown to more seniors who need to hear it. If you are not yet subscribed to this channel, subscribe and turn on the notification bell so you never miss an episode. Every week we bring you the kind of evidence-based health information that your doctor may not have time to explain in a 15-minute office visit. And in the next video, and I really think you are going to want to watch this one, we are going to talk about a specific combination of two natural compounds that, when taken together at a precise ratio, have been shown in clinical studies to reduce arterial stiffness in seniors by up to 30% in 90 days. Arterial stiffness is one of the primary drivers of heart attack and stroke risk, and almost nobody is talking about this research. It is coming very soon, so